I am Shannon Campbell. I am the Director of Surgical Services at Oswego Health.
So I'm interested in a job in healthcare. What are some avenues that you would suggest for me?
Well, we have registered nurses, and they're called circulators. You become a registered nurse, generally going through a 2-year program. For surgical services, we'd prefer to have a year of experience on med-surg, which is medical surgical nursing. It's a great place to get a good foundation to learn how to multitask. You learn how to become flexible, adaptable, you get your communication skills, you develop empathy. There's also in perioperative services something called a certified scrub tech. And what they do is they're right at the field for the procedures, for the surgery. They're elbow to elbow with surgeons and physician assistants and registered nurse first assists. And that is generally a 1-year certification program. And then there's also anesthesia technicians. They generally work alongside anesthesiologists and nurse anesthetists. They keep the machines running, they do troubleshooting for the anesthesia machines, and they do a lot of stocking.
So now I'm looking for a job at Oswego Health. What are some soft skills that you would recommend for me to have if I was interested in a job there?
Well, definitely someone who is adaptable and flexible. As healthcare in and of itself has changed, just daily within your shift. Things can change very quickly, not necessarily bad, not necessarily good. Your assignment could change. And so you have to be able to adapt and flex to the change. Also, communication is vital. Being an effective communicator, understanding how you communicate, how other people need to be communicated to. Teamwork is a huge part of that because it does take a village to take care of someone. There's many aspects to the healthcare, as we've discussed a little bit, but teamwork is huge. If you're not able to be a part of a group that has a shared goal and a shared vision, it becomes very difficult, and negativity can spread very fast. And it's already it's a rewarding area to go into. It's challenging, but it's very rewarding. But you have to be a team player. No one person can do it alone. It can be very stressful, and that's why having good coping mechanisms in place is very helpful. People are very smart. People are intuitive. A lot of people can feel the vibe that you put out. If you come in, you walk into a patient's room, obviously they're in the hospital for a reason, or they're in a doctor's office for a reason. They're not at their best. And if you're not at your best, or at least putting on a brave face to get through the day, people sense that, and then they feel that they're not your priority. And that's one thing that's important. People need to feel like they're a priority when you're with them at that time.